So, what's going on, YouTube? All right, so have you ever um, had, have you ever wondered if you have carpal tunnel, or have you had carpal tunnel surgery, or are you in the process of having carpal tunnel surgery? If so, stay tuned to this video because I recently had carpal tunnel surgery, and the videos that I saw on YouTube, my surgery was nothing like that. Trust me, it was nothing like that. And I'm gonna go over everything from A to Z, what I went through, from being diagnosed to actually having the surgery. And I'm a week out from having the surgery. I just had it done on December 23rd. Okay, so about, I want to say, what was it, maybe 3 years ago, when I was living in Las Vegas, Nevada. This is when my symptoms started, but I didn't know that that's what it was. So I was at work. I do home security installs. So if you think of ADT, Brinks, things like that, that's what I was doing. I was doing those installs. So I was at a customer's house, sitting in his garage, talking to him, and then all of a sudden I started having this tingling feeling up my left arm. So I started thinking about what are those acronyms? So if you think that you're having a stroke, I think it's like B fast or something like that. So I started feeling a little lightheaded for one, and then with the tingling, that was another one. And so I started talking. My talking was normal, so I'm like, damn, is it a stroke? I don't know, it might be, but they say that you normally slur your speech or whatever when you're having a stroke. But that tingling up it was like from my pinky, not from my fingertips, all the way up to like my shoulder. So I was like, all right, let me go ahead and go to the hospital. It was like a hospital maybe 2 miles away. So I drove myself to the hospital, called my wife, told her, hey, meet me at Sunrise Hospital. I'm getting myself checked out because I'm not feeling right. So went there, they did all the blood tests or whatever. They was like, okay, you're not having a stroke. And I'm like, so what is it? And they're like, well, we don't know. Talk to your specialist or whatever, your primary care physician. So I'm like, okay, let me set up an appointment, talk to my primary care physician. So I did that. He ran a couple of tests, had me go see, you know what? I don't even think he had me see a hand specialist back then. They just did tests, and they were just trying to see if I was having a stroke, pretty much. So they didn't even discuss carpal tunnel or none of that stuff. So I went through that for a year, for about 2 years. So back in 23, I moved out here to the Dallas-Fort Worth area. So I was still having the same issues. It would happen, come and go, come and go. So and I would notice that it would really happen when I would drink coffee and when I would eat like any type of sweets. It seemed like it would like come up, into my it would really aggravate the nerves in my hand, and I would feel that tingling. So I'm a big coffee drinker. I'm Dunkin' Donuts all day long, but I just had to leave it alone. So I found another primary care physician here in the Dallas-Fort Worth area, and she referred me to a specialist, and they did what is it called, a EMG. So it was a neurologist. She referred me to a neurologist. They had me do like an EMG. So they put these little clips on my hand, like they was like jumper cables and stuff, and and then they had this little this little metal thing with 2 prongs on it, and they would like put it on different parts of my wrist and my elbow and things like that. So they did that, and they pretty much said that like I got my results here. It said right and left median motor nerve conductor studies are normal. Left ulnar motor nerve conduction study shows normal latency, normal aptitude with conductor block, blah 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 blah. So she pretty much just gave me this wrist strap and said, just wear that. Just wear that. And that was pretty much it. So I was like, you know what, this doctor, I don't think she knows what she's talking about. So I went ahead and just got me a new primary care physician, and I told her what the issue was, and then she referred me to a hand specialist. So I went to go see the hand specialist, and what happened there is that he had his resident come in and test me, and what he did is he told me to like put my fingers together like this, and then he hit like these pressure points, and he was like, "Do your fingers feel numb?" I was like, "Yeah, they do." So so he was like, "Yeah, you got carpal tunnel." So I told him like, "Yeah, but it's not just in my wrist; it goes all the way up to my shoulder." So he had me put my arm out, and then he did some little pressure tests down at my elbow, and he was like, "Oh yeah," he was like, "Do your fingers feel numb when I press here, press here?" I'm like, "Yeah, they do." All right, so he was like, "Yeah, you got carpal tunnel, but it's going. You need a release on your wrist, and you need a release on your elbow." So I'm like, "All right, cool." So the doctor, he came in, and when he came in, he did the same pressure test. Like, "All right, yeah." He was like, "Yeah, you need carpal tunnel. I think it's carpal tunnel." And then he said one thing that made me fall in love with him. He was like, "So, are you a coffee drinker?" I'm like, "Yeah, I used to be." He was like, "When you drink coffee, would it like irritate your nerves really bad?" I was just like, "I love you, Doc." So I was like, yes, it does. So he was like, "Yeah, you definitely need carpal tunnel release surgery." So I was like, "All right, cool." So he set everything up. I had to wait about a month and a half. I was supposed to have it done in October, right before Halloween. But because of my job and, we got real busy at the time and stuff, and I didn't really want to take the time off during the busy season. So I pushed it back to December 23rd. So, because I knew I would be off. Christmas time is like our slow season. So I was like, all right, if I got to be off for a week or two or whatever, it wouldn't matter because it's going to be slow anyway. So they set everything up for the 23rd. Went into the clinic on the 23rd. Oh, no, actually, first what happened is he told me I had to pick up this soap, this antibacterial soap. This is what it is here. So, hydrocleanse. I can never pronounce stuff like that. Any type of medical term. But yeah, this is what it is. So I had to get this soap, and I had to wash with this 3 days before the surgery. So it's an antiseptic skin cleanser is what it is. So had to take it actually 2 days before the surgery, the day before the surgery, and then the morning of the surgery. So I had to be there at 7:45 in the morning to do the surgery. So I watched a bunch of YouTube videos, so I wanted to know what the whole process was as far as getting it done. And and I saw the videos. They would say that it's pretty much everybody that I saw in the different videos, and these videos were like from 6-7 years old, so they were like older videos. And people, they would just sit in the chair like they was giving blood. Have your arm out like this, and the doctor, he just does his thing. He make a small incision on your wrist, and then he goes in and cuts the band that holds all of your nerves together, and it kind of opens it up so that your nerves, they can, they're not constricted and tighten inside that band, and that helps relieve the pressure. And that's pretty much what carpal tunnel is. It's just basically your nerves are just compressed inside that little band like a rubber band, and they just go in and cut the band, and everything just kind of expands out. So they had to do it there and here, but I never saw nobody get it done on their elbow. So as you can see, I had it done here, and I had it done here. Okay, so everybody was pretty much that I saw, they were just sitting in the chair with the doctor, and they were just like like it wasn't nothing to it. I guess he numbed the arm or whatever, and they just did it. So, so they told me, they was like, okay, you gotta have somebody to drive you. You gotta have somebody over the age of 18 that's gonna drive you, because you're gonna be under anesthesia. They're gonna put you under for the surgery. I'm like, put me under? Everybody on the video I saw, they were just sitting there. They were wide awake when it got done. But I guess because I'm getting it done on my elbow too. No, actually what they said is because some people, they're like they get nervous and stuff, when they cut the skin, and they would move. So they don't want people to be awoke when they do it. They want people to be under. That way the arm is relaxed and they can go in and do what they got to do without the patient moving. So I'm like, all right, cool. So, I got my wife. She drove me there and everything. So I got there, filled out the paperwork, and then we got to the they called me in the back. So went in the back, and my wife, she was in the waiting room. So the lady, she come in and she handed me a gown, and she basically just said, take off all your clothes. Like, take off all my clothes? She was like, yeah, even your underpants. Take everything off. I'm like, don't threaten me with a good time. So, so, and then she was like, do you want us to have your wife to come back here with you? I'm like, what type of freaking mess y'all on this? So, I'm like, yeah, sure. So she just handed me a gown and a pair of socks. I'm like, what are y'all on? Because every video I saw, everybody was fully dressed, sitting in a chair, getting the surgery done, in and out, 15 minutes. So I'm like, all right, cool. So I asked her, like, so why I gotta get, butt naked and stuff to get this surgery? They're like, well, we don't want, if you have like pet hair on your clothes or whatever, we don't want that stuff to, you don't be in the operating room. So we don't want that stuff to get in the air and it might get infected, because, we're going to open up your arm in both places. We don't want it to get infected. So that's why we want you to just be, pretty much completely naked and just have the stuff that we give you. So I'm like, all right, cool. That'll work. So I get it. So she gave me that, gave me a little hairnet. See, I ain't got no hair, so I don't know why they gave me a hairnet, but all right, whatever. So I put all that stuff on. Wife coming to back, so they come in, and the one chick, she was like, yeah, we're gonna give you this anti-anxiety medicine so that it'll keep you calm and stuff going in the back. And I'm like, well, shit, I'm gonna be knocked out. I think I need some anxiety medicine for it. I ain't got nerve. I ain't y'all jittery and stuff like that. So I don't really need all that. I don't really like taking a lot of medicine and stuff, no way. So I was just like, nah, I'm good. I'm silly as hell anyway, so I don't need that. I'll be cracking jokes back there and stuff until y'all knock me out. So, so yeah, so they do that. The nurse come in, and then she wheel me into the operating room. Wheel me in the back to operating room. So the doctor, whole team of people come in. And then they do this thing called a huddle and stuff. So they come in, talk to me. The anesthesiologist talk to me, tell me what she gonna do. Doctor, he come in, tell me what he gonna do. Got all his people around him, and he basically just they doing everything. It's sort of like being on the airplane. They had a little checklist. So like, we gonna do this, check. So the lady on the computer, like, check. We gonna do this, check. We're gonna do this, check. So they got their stuff down to a science. I'm like, I was really impressed. I'm like, they down with everything. So they made sure that they, wrote on my arm and stuff, which arm it was. Had to verify it's the left arm, not the right arm. I'm like, all right, doc, make sure my bionic arm is good when you get finished and stuff. So I'm back there just cracking jokes with them and stuff, just having fun with everybody, and everybody was just super cool and stuff. So she tell me to lay back. She's like, all right, cool. So I'm gonna put this mask on you and stuff, and I want you to take like 4 deep breaths. So I'm laying there just looking up. It's like 1, 2. Mr. Jackson, Mr. Jackson, are you okay? All right, you're gonna be a little drowsy and stuff, but yeah, we're just gonna let you stay here until you're straight and everything. I was knocked out and woke just that quick. By the time I got finished saying 3, surgery was over. I'm in the recovery room, just waking up. Didn't feel nothing. It went just that quick. So, I'm sitting there all groggy and stuff, just I think they had to put some type of tube in my mouth, so it had my throat feeling, real scratchy or whatever. So, I'm drinking water and stuff, trying to wake up. And then they was like, all right, well, you just lay here until, you feel ready to get up and go. And I look down and my arm is like just wrapped up. Where is that stuff at? Yeah, they had like these pads and stuff going all up my arm. And then they had it wrapped up and everything. And yeah, and then they just told me like, hey, just keep it wrapped up for a week. If you need to wash it, take like a bread bag or umbrella bag, put over your arm so when you're in the shower. And they had some different stuff on here, but once I took the bandage off, the little thing that they had, actually I'm gonna show y'all real quick. I'm gonna show y'all the scar. All right, so this right here, that's the little scar right there. So just a real tiny scar. And then the one on my elbow, let me get this off. So this right here, real tiny scar. Yeah, and that's it. So, it didn't hurt at all. The only thing that happened when I got done is my pinky finger, these 3 fingers here, they just felt kind of numb. What you said was gonna be normal, and I just had to do like these exercises, just doing this with my hand and stuff. So I did that for a little while, and yeah, and that's it. And then I would say probably after 2 days, the numbness went away, and they prescribed me these pain medications. So gabapentin, which I think I've only taken 1 of these. Yeah, today is January 1st. This was done on December 23rd. Naproxen, I haven't taken any of these yet. This will be for pain. And then it's acetaminophen with codeine. So basically Tylenol with codeine. This is what I mainly been taking. So I probably got about 4 of these left. And yeah, so after the surgery, I was off for a couple of days. I think I had on the 23rd. Job came through on the 26th. So me not wanting to miss out on money and stuff, I just went ahead and did that job. So I was, like real careful, basically using my right hand. But my job, I really need to use both hands. So, but I was just real careful the first day, and then I was like, all right, yeah, I'm cool. I don't feel nothing. When I went in the second day, I was cool too. But then yesterday is when I made a mistake. So I took the wrap off Saturday. Yeah, Saturday. Keep thinking today is Sunday. I took the wrap off on Saturday, and so that way my arm was free. But when I took the wrap off, I guess because of it must have been compressing my arm, because when I took it off, my arm started to hurt a little bit more. So I started taking the Tylenols or whatever, and it kept it straight. So I was at work yesterday, and I was putting up some security cameras for a customer, and for some reason, when I let down her garage door, one of the metal bands that help roll the door up, the one on the left side snapped. So when I went to let her garage door down, it went down kind of uneven. So so I was trying to push it down until she can get a garage door guy to come out there and fix it. So I was trying to just use my right arm to kind of let it down, but then I use my left arm a little bit too, not really thinking, just, I was just moving. So I wasn't using my hand as much. I was mainly using my forearm to kind of push it down because I wanted to get a garage door down as much as possible to get it secured so nobody would come in. And why did I do that? Man, my doggone arm was hurting like crazy yesterday. I was just in pain. It wasn't a pain. It was more so, it seemed like that tingling that I had before it came back. And I know that's all it was. It was just the nerves. And the doctor, he told me, he said, it's not like you're going to snap nothing, but your arm is going to let you know that you messed up. So he said, you're going to know when you did too much because your body is going to tell you you messed up. And man, I messed up real bad. So yeah, I was popping them Tylenols and just drinking water and stuff like crazy and stuff. And woke up this morning. It felt a little weird. It still felt a little tingly, but right now I don't feel nothing. I'm good. My arm is straight. So I am totally good. But yeah, I just wanted to share that story because like I said, I've seen a whole lot of YouTube videos because I wanted to get myself mentally prepared for this surgery. But everything just seemed to be like medical stock stuff. They showed the actual surgery, but I didn't see any testimonials from actual customers that actually patients that actually got the surgery. So yeah, if you have any type of like tingling in your arm and stuff, and even though it may be way up here like in your chest area, yeah, hire your doctor to check it. Go see a hand doctor, because that's what I wanted to go see. I saw a hand doctor, and he checked for the carpal. So he said if it's just in the wrist, it'll just be like your forearm, and that's why they normally give you like these straps right here to kind of keep your wrist straight. Just put that on, and then it just keeps it straight. But if you got to get a release in your elbow, that's when you're gonna feel it all up in your chest. So yeah, so hopefully if you're having pains like that, because like I said, I went undiagnosed for like over 2 years and stuff. Nobody really could tell me exactly what it was. But then yeah, as soon as that doctor told me about the reason why he said coffee irritates it is because the caffeine actually makes your nerves expand. So that's why the coffee would irritate it, because my nerves would expand inside that band, and all my nerves, they would just be constricted inside that small little tunnel and stuff. And yeah, so I was like, all right, cool. So I tested it out, and I got my Dunkin' today. And when I did that, I didn't feel nothing. So I'm good. I'm good now. Now I can go back to drinking my coffee and stuff, and got to worry about having all that pain and stuff in my arm and my shoulder. So yeah, so man, if y'all having any type of issues like that, definitely go see a hand specialist. Tell your primary care physician to give you a referral to see a specialist. And if they start doing that ECG, what is that thing called? That EMG crap, that putting the little shock stuff on your hands, tell them, nah, I ain't trying to do that. Let me get somebody that can actually do it. And if you look on YouTube, there's some doctors, they show you how they do the test to see if you got carpal tunnel. Make sure that your doctor does that. So it's like pressure points, like in your hand, like right around here, and then like in your forearm, it's some pressure points like right around up in here, and they'll be able to tell you if you got it or not. And if they say they're gonna do the release, it's called a carpal release. Go ahead and get it. Trust me, because that pain ain't nothing nice. It is so irritating when you just going through pain like that, for days and weeks at a time. For me, years. just go ahead and get it done. This is simple. It literally took them, he said the whole process took about 20 minutes. Quick little 20 minutes. I ain't even realize it. Like I said, I breathed in that anesthesia. On that third breath, I was knocked out. Woke up. Seemed like no time had passed at all. So go ahead and get it done. Hopefully this helped y'all out. I'm gonna be making more videos and stuff, just showing people different things that I've learned over the years that help people out. So that's my thing. I just like helping people out, whether it's, you know, financial, job wise. That's another video I'm gonna do, is like show people different jobs that they can get that's actually recession proof. And yeah, you'll be surprised at some of the jobs that they don't talk about, where you can actually make a lot of money. So I'm gonna put y'all up on that. So yeah, so hit that notification bell, so that way when I drop another video, y'all get notified of when I drop that. So I'm gonna try to do some at least once or twice a week or whatever, you know, if time permits. But yeah, just go ahead and give me a like, give me a subscribe if y'all like this video. If you got any questions, put them in the comments. I'll get it. You know, I'm on my phone pretty much all the time due to my job. So if you got a question, I'll get a notification. I'll try to answer it as quick as possible. And yeah, so all right, y'all. Happy New Year. Hopefully y'all have a good year. Health is wealth. You got any problems with your health, definitely get a first, second, third, fourth opinion. Don't take that first opinion. You know your body better than anybody else. So if it's something going on with your body, the first person, they blow you off, don't go to the ER, because ERs, all they care about is, are you dying or are you not dying? And that's what they told me too. They said our whole thing is to make sure that we keep you alive enough to go see your doctor. So if it's something that's minor, it's not life or death, but something minor, you know, do your research. You know your body. Don't let a doctor tell you something. You know, we are not monolithic, so we know our body's better than anybody. So advocate for yourself. And men, go get tested. Go get your prostate tested. Go get your blood tested, your cholesterol, get your heart tested, do all that stuff. So I'm a big proponent of that. So I go to the doctor. I got kicked off my last insurance. So I was at the doctor like every week, because I'm not taking no for an answer. If something going wrong, y'all, I'm gonna keep coming back until y'all tell me, you know, find out what it is that's wrong. And I'm gonna keep switching primary care physicians until I find the right one. So yeah, definitely do that. Do that. Advocate for yourself. Advocate for your kids. Ladies, get your men into the doctor. You know, I know men, we can be real stubborn and stuff, but you know, I'm trying to be 100. So I want to see my grandkids, have grandkids if possible. So yeah. So happy New Year, everybody. Till the next video. See y'all later.